Hi, Dr. Ryan. How are you?
I'm great, and sorry for being late. My life is a bit mad at the moment.
Oh, and you know something, we totally understand, and thank you for taking your time out of your busy schedule to take part in the event today. Traveller Homes, Homes, Build Health, Build Hope. And do you want to take a minute, or will we go ahead with?
Oh, please go right ahead. Go right ahead.
That's perfect. There are some people that don't know the meaning of social determinants of health. So what are the social determinants of health?
Sorry, I'm just trying to get my notes organized here.
Yeah, go on ahead.
Thanks for the question. I mean, first of all, I love the title of your event today, Homes, Health and Hope. Three very important H's in our lives. I think we, for many centuries, for eons as humans, we lived in a world where disease was something that was seen as, it was the wrath of God, it was punishment for wrongdoing, it was all of the things that we had a mythology of disease. But in reality, most of disease and most of the illnesses that we have suffered as populations over the centuries have been more determined by the social circumstances in which people live, rather than by the diseases themselves. Our vulnerability to disease is increased by so many factors in the environment around us. And those factors are physical factors, like where we live, overcrowding, poor housing. There are social factors in terms of everything from income, inclusion, access to healthcare, access to health promotion, and they're also driven by our own behaviors. So therefore, those social determinants can be physical, environmental determinants, they can be community determinants, and our own behavioral determinants. And they drive the presence or absence of health. And that's not just for infectious diseases, that's for heart disease, for hypertension, for diabetes, for mental health. More than anything, all of us know instinctively that our mental health is so much determined by the environment around us, more than necessarily by anything else. So they are the social determinants of health, and we cannot deal with health. We cannot give people healthy lives, and we cannot preserve healthy lives unless we deal with those social determinants.
Very good. Thank you very much. And look, we all lived through the spread of COVID-19 virus, and we know that it has impacted on the disadvantaged communities. But what impact has the social determinants of health had on the spread of the virus?
Absolutely massive, both in terms of the spread of the virus and the impact. And if we look at the two things, one thing is a virus spreading. I mean, there are mild viruses that spread all the time in communities. They don't cause devastation. It really is what those viruses cause in terms of illness and hospitalization, and ultimately in avoidable death. And the reality is that both factors, both transmission factors, the speed at which the disease transmits, and the impact are driven by social determinants. If you live in an overcrowded setting where you don't have the capacity to implement basic measures to protect yourself or your family, if you have to go to work because you're paid on a daily basis, you don't have insurance, you don't have unemployment, you can't stay at home, and you must go out and you must engage with other people. So your social situation, your education, your employment, your work-life conditions, if you're in a meat factory, so many factors will put you in harm's way potentially. And the reality is around the world that poor, marginalized communities have suffered more in terms of the spread of the disease, and have suffered more because, number one, many communities have underlying conditions. They have spent years and years without access to healthcare. years and years with those social determinants of health have left them vulnerable. So when they do get infected, they get a more severe disease. And we've seen that come through again and again in the data. And then when they do get sick, they don't have access to the healthcare that they need because they're shut out of the system. It may not be shut out in somewhere like Ireland, but there are barriers still to accessing healthcare. There are real barriers in many countries where the healthcare doesn't exist, or where because of your ethnicity or because of your skin color or because of your social class, you can't access healthcare because it's privatized, it's not accessible to people who don't have money to pay. But even in a context like a developed country like Ireland, there are real barriers, and you know that in the traveller movement. There are real barriers that they're not physical barriers and they're not necessarily financial barriers, but there are barriers to accessing the healthcare that you need. And there's social and psychological barriers, acceptance barriers, and other things. And it's about making that decision to access healthcare. And many communities don't feel safe, psychologically safe in doing that. So they will always and very often decide to seek another form of care because their trust in the system is not fully there. And therefore, there are both self-imposed barriers and physical barriers, financial barriers to that. But there's no question in my mind that this, and I've said it on many webinars before, this pandemic has caused its own wounds, absolutely. But it's also ripped away bandages from some very old wounds in our society. And we're paying a heavy price for the lack of inclusion, for the marginalization of people. And we're now reaping unfortunate consequences of leaving so many people outside the healthcare system globally, and not having strong healthcare systems that are able to cope with the number of cases we have. Back to you.
Thank you. And you're so right, because that gap keeps getting wider and wider. As a traveller, I and 40 other 1,000 travellers has experienced inequalities in Ireland. So what does Ireland need to do to address the inequalities experienced by my community? How do we address the power imbalance?
Well, you are speaking a truth, and a truth that's experienced in many countries by many other communities who are marginalized or outside the system, or at least feel that they're outside the system, and do not feel empowered very often to have the system do what it should do. I mean, first and foremost, I don't have all the answers for sure, right? Mm. And I don't want to engage in tokenism where I'm telling you this is what you should do or anyone should do. But I think the first thing we must all recognize as we say things like we're all in this together and we should leave no one behind, and all of these lovely terms, right? But if you're living in a difficult situation, if you're living in a situation, an overcrowded situation where you don't have access to the services you need, and you're pushed out of your community, that doesn't mean, you are being left behind. And we're not all in this together. There are different rules for different groups. And there has to be a broader recognition when we say things like that they're not just tokens. So we can all feel good about ourselves and go back to our middle class lives and feel very good that we think everything should be equal. Equality and equity don't come from saying it. Yeah. They come from doing things and actually making a commitment to change. I was on a podcast with Brezzy a number of months ago. We were talking about mental health, and we were saying, look, if you change nothing, nothing changes. The reality in Ireland is the traveller community, and it's community I know well, and I have the deepest of respect for, and I grew up with many young friends as a young boy. We are all in this together. But there has to be dialogue. There has to be a fundamental recognition in all societies and in Irish society that there need to be voices for everybody, real voices, not just token voices, but real dialogue around how we make the situation better for everyone. How do we address the housing crisis? Then how do we address the housing crisis amongst the traveller community? How do we address the issue of health and health determinants, social determinants of health in the traveller community? And what is different? And why is that the case? And sometimes outsiders all have the answers. They come with the questions, the answers, and tell you what's wrong. I think we need a different dialogue. I think we need communities all communities who feel marginalized, to actually be able to have a voice to say, this is what's wrong, this is what's happening, and more importantly, this is how it could be fixed. And I think that's where sometimes the dialogue stops. The dialogue stops at co-creating the solution and actually listening to what communities know. My experience around the world, to be honest with you, I do epidemics and crises and other things, but for me, the epidemics begin and end in communities, and the answers begin and end in communities. And listening to communities and having that dialogue and having what you're doing right now, to me, is fantastic. That leadership within your community and representing that community at all levels and demanding that dialogue and demanding that voice, and not only having the voice heard, but having action taken in response to that dialogue. And that's where it sometimes stops. You have these, sorry, I'm being very direct, but you end up in a lot of, we end up in a lot of discussions, and everyone is very happy to have the discussions, and we can put out the press release and have the nice photos, and everyone looks like they're good and kind and tolerant and all of that. But none of that matters unless there's real change, unless people truly change what they do. And to change what you do means you must change how you think. And we, as a society, all of us, have biases that we're not even conscious of. And we carry these biases around with us our whole lives. And we look at a certain community and we immediately make judgments. We project our beliefs about a community onto that community. And then we expect that community to behave or act in a certain way. And then we're not surprised if they do. And it turns into a self-fulfilling prophecy, which further isolates and marginalizes a group. And the only way we get around that is we bring people together in a dialogue and to talk and to fully understand each other. And from my perspective, that's what I like. That's why I come and want to be engaged in webinars like this, because we can do all the high-level press conferences we like, and we do a global press conference twice a week, and we can talk to the world. But the real conversation that needs to happen in the world, if we're going to change it, is at community level. That's where the conversations need to happen if we're to fundamentally change the way our society operates and the way we include or exclude groups. And none of that is going to change unless we move beyond the tokenism of saying there's a problem, and we move towards changing the reality together.
That's great. And look, don't apologize for being too direct, because the softly approach doesn't work anymore, and because we get nowhere. And look, at mental health was and still is a huge issue in my community, which suicide 6 times the rate of the general population. This accounts for 11% of traveller deaths. And if we only make up 1% of the general population, we're talking huge numbers. That was from the All Ireland Traveller Health Study in 2010. So where are the resources needed to address the increase in mental health difficulties post-COVID? Because we are afraid that we might be pushed into a huge pandemic of mental health post-COVID.
No, that's a pretty shocking statistic that you just laid out there. I wasn't aware myself personally of that. That's a real difficult number to even imagine, and a terrible burden for a community to bear, because in that situation, there just must be constant fear of everyone around you, because everyone is suffering, and the whole society is suffering at every level in every country. All communities are suffering, and I think there's a general recognition that our mental health, the mental health of our older and wiser generation, the mental health of our children, the mental health of everybody has been affected. And this pandemic has just, I think, amplified what was already an issue. As you said, those numbers are pre-pandemic numbers. I think it can certainly not make the situation any better. Mental health is a pandemic in its own right, or mental health problems. And what we're seeing is, as communities become, as you said it there in your previous statement, I could sense that slight pessimism in your voice, saying, well, nothing is changing, And I think that also adds to the mental health burden. If people don't have hope, the last word in the title was hope. And I think it's the last thing we have as a community or as an individual, is that ability to hope, to see a better day tomorrow, regardless of your situation, to believe that something will improve, that life can change, your circumstances can change. And I think when people lose hope and they don't see that future, that really adds to the mental health burden and the psychological stress. And we have to give people a pathway for hope and a pathway in which they can rebuild their lives. Because mental health, you don't solve mental health problems with the snap. It's not just about resources. It's a process. And it requires a long-term commitment to dealing with those underlying factors that drive mental health problems. And there are lots of stresses that drive that. And I'm sure you can explain them to me much better from within the traveller community, what they are within your community. But we collectively, and I mean that at a global level, we are underestimating the tsunami of mental health issues that are emerging for so many different reasons. We have millions of children living in conflict situations. We have so many people who are migrants around the world who live in desperately uncertain circumstances all the time. They don't know where they're going to be tomorrow, if they're going to be deported, if they're going to be accepted. You know, there are so many different groups living in overcrowded slums around the world who live on $1 a day, and they have to go to a street corner every morning and see if they can earn enough money by getting some work to feed their family that day, not next week, but that day. That amount of stress, that is a huge burden for any human being to carry in those different circumstances. And I'm sure there are people in your community, and I would assume, like in most communities around the world, it's the women in your community who bear most of that stress burden too, trying to hold things together, keep families together, keep families moving forward. And in many communities, it's women who bear the double burden of having to absorb that extra stress within a family or within a community. I would like to see Ireland and the rest of the world have a much more fundamental investment in mental health, but it also needs to move down to community level. Mental health isn't about putting people in institutions. Mental health is about preserving the mental health we have, giving people the skills to manage their own mental health and cope better with the situation they're in. But it's also about changing the situation people are in. There's no point giving people coping skills when in fact they're coping with unacceptable situations. So we have to change both. We have to change the situations that people find themselves in and the stresses that they're under constantly. And then we have to also give people more capacity to cope. And for those individuals who are in danger, for those individuals who are at risk of self-harm in particular, we must have better urgent services to save lives. So it's going to require a lot of investment along the way to do that. But you can't get away from the underlying stresses that a community feels. And the mental health issues are a direct result of that, you know, progressive, expanding, building up, underlying stress that a community is under. And I would assume that the traveller movement in Ireland, you know, is and has been under stress, and that's been made worse by the pandemic.
Thank you.
And to say, Kathleen, I noticed that there is some questions coming through. I don't know what time you were going to move on, but just to alert you in case you wanted to bring in Vivienne.
Yeah, I'll bring her in now in a few minutes.
Yeah.
I'll just have one or two more questions for Dr. Ryan, if that's okay. And you're right, and thank God as a community we're resilient. If not, I'm sure there wouldn't be what we'd call our Indigenous community in Ireland today. My community also has experienced racism for generations in Ireland and still have a negative impact on our daily lives. Has there been enough conversation, do you think, at a national level or international level regarding the needs of ethnic minorities? Should racism be declared a public health issue, do you think?
Well, you know, racism is a poison in all societies. You know, we see it in so many aspects of daily life. There is, and it has so many different manifestations. And clearly, one of those manifestations, one of the outcomes of systematic racism is unfair access to healthcare, marginalization, othering of people to a point where they don't get access to education, they don't get access to healthcare. So ultimately, yes, there is a health consequence to racism, a direct psychological consequence, a denial of service consequence, a marginalization consequence, a poverty consequence, an education consequence, and all of those lead to ill health. So yes, racism is a health issue. And we say in W.H.O. is we have a fundamental right to health, social, mental, and physical health. And that is written into the W.H.O. Constitution, that every human being has a fundamental right to that health. So racism is a barrier to that health. So racism is a health issue. It is absolutely a health issue. And, you know, the Irish people in general don't need to be told about racism. Irish people have experienced it for generations and for centuries. But is unacceptable then as a community that we would then expose people within our communities to the very thing we as a country and as a people have suffered for many centuries in many circumstances. And that to me is, you know, if the measure of any society is how you treat not the people who are the same as you, but how you treat people who are not the same as you for whatever reason, religiously, ethnically, from a racial perspective, from a language perspective. There are so many different economic perspectives, right? So it's very easy to be tolerant of people who are the same as you or you perceive as the same as you. The real test of our humanity is not that. The real test of our humanity is our tolerance and our inclusion. And clearly, I would definitely agree with you that ethnicity, it inherently is associated with poor outcomes in health. There are some reasons why different ethnic groups may experience different diseases in different ways. There are genetic reasons underlying, but the vast majority of the reason why people in certain ethnic groups have poor health outcomes is to do with the social inequalities, it's to do with exclusion, and it is not to do with their genetics, and it's not to do with their underlying humanity. It is to do with the social circumstances in which they live. It is to do with the access to healthcare they have. It's to do with their education, their wealth, and it's to do with the degree to which the society within which they live accepts them as equal to others. And we still have huge issues. We still have modern day slavery, indentured labor, you know, systematic racism. It's not gone away. In fact, if anything, it's getting worse and becoming more acceptable and more tolerated. And something that we as a global community, I'm a global citizen, proud Irish national, but it's something that I myself, when I think of my country and I think of all the wonderful things that I feel proud about, the things I'll feel less proud about are sometimes when I see images of racism, images of exclusion that come from Ireland at times. Yeah. I think we're better than that. And I think we are a small country who should be open, tolerant, inclusive, because our society is stronger and better for that. Not because it's the nice thing or the right thing. It's just the smart thing for us to be. An open, inclusive, tolerant, outward-looking society that sees the value in every person. I mean, I work in the World Health Organization and for the United Nations, and people criticize the United Nations, but I am really proud to wear my lanyard and to wear because it's the United Nations. It means something to me. Yeah. That word has meaning to me. And I try to at least give my professional life for achieving that goal of uniting nations, of leaving no one behind, of always, and we talk here about being servants. We're not here to tell people what to do. We're not here to be paternalistic and to give, you know, the gift of science and health to people. We're here to serve the most vulnerable people in the world. We're here to serve them. We're here to stand up for them, to speak for them, to give them a voice. That's our job. And we need to be really good at that, because there's a lot of forces that work against that. And that would be the same in Ireland. There's a lot of natural forces that work against equality, and they work against inclusion. So we need our best people in all parts of society to work together to make sure that we demand inclusion, we demand tolerance, we demand equity in our society, because that's the society we want to be. That's the society we want the world to see, is an open, tolerant, and inclusive society in which everyone has a voice and in which everyone has equal access to healthcare, equal access to social care. I know it sounds like a pipe dream to you who live in a community that has been much marginalized, but I don't think it's impossible if those of us who give a damn actually want to go and make changes.
Yeah, thank you. And you're right. And unfortunately, racism and discrimination is alive and well in Ireland, and we as travellers has experienced it too often. And for me and my community, Dr. Ryan, listening here today, could you give a message of hope in our call for change?
Well, as I said before, change nothing and nothing changes. So we have to make change, because change is constant in life if we want to move on. So yes, I would, but you know, hope springs eternal. I'm a natural optimist. I find that every morning I get up, and some mornings I get up, and I'm sure it's the same for you. I think that there's some mornings you get up and you think, oh my God, I can't do this again. You know, this is just too much. There's too much to do. We're not making progress. And then something inside me clicks and says no, because we have to keep hoping. We have to keep moving. We just have to keep trying. And I think that's a human condition. That's not just me, that's you, that's so many other people. So if enough people get out of bed every day and try to just change something, then everything will change. And that means everyone has to change. Everyone in your community, in the broader settled community, everyone has to make a move. Everyone has to do something to change the status quo. And then things will change. Everything will change when everybody changes. And that's everybody. And we can't, you can't look outside your community for the solutions, and neither can people outside your community look to you to provide all the solutions. There has to be a partnership. And there has to be a thing where everybody moves. There are lots of social problems in every community, and you know more than anything that some of those social problems are generated internally within a community. Some are forced and imposed. Some are amplified by external factors. But there are things within every community that can move and change. Everybody needs to take action, from young to old, inside a community, outside that community. And I believe I'm an incurable, hopeless optimist. And I have great friends in the traveller community in Ireland, and I grew up with many friends, and some of the most intelligent, smart, funniest people I know. From my perspective, we should be proud of our traveller community as a nation. That's what we should feel. We should feel that diversity enhances us. We should not be othering people. And you know, we've heard all those pejorative terms over the years about travellers of this and travellers that. That's not the reality I've experienced. You are a proud people who have much to contribute to Irish society and much to give. And I think you should have the hope, and having representation like you and the others in this movement and so many other movements around Ireland, this is what we need, I think, as a community and as a society. So I have great hope participating in this and hoping that everybody makes a change, not just you or me or others pushing for big changes, but that everybody gets up in the morning and says, I can change. I can change my attitude. I can change my behavior. I can change what I do today about this issue. And if we do, I think things will change.
Perfect. And it'd be great to be able to live in an equal society where you don't feel that you have to, on a daily basis, experience some form of racism. Dr. Ryan, if it's okay, if you could, I'm going to pass you over to my colleague Vivian Ivers, just for a small Q&A and I know your time is limited, but we won't hold you too long.
Right, Dr. Ryan, thanks for that input there. I know we're limited on time, so I was just going to maybe call out two questions that I've been monitoring here in the Q&A. So from Ronnie Fay at Paddy Point, a key barrier in Ireland is the absence of the collection and analysis of ethnic data. This has made it challenging to accurately capture the true impact of COVID on traveller and Roma communities. What can you do to encourage our health services to collect data disaggregated by ethnicity?
Ronnie, that's a brilliant question, because it's a huge reality, and we've had the same issue with gender over the years, same issue with age, and now we have an issue around ethnicity and representation. What gets measured gets done. If we don't measure things according to the groups, then we're never going to have the data to make the changes and actually identify the extent of the problem and then chart any improvements that we make. So it's absolutely important that the system in Ireland and globally collects disaggregated data. So we actually specifically collect data on the health experience of different communities, so we can compare and track that. If we don't do that, then we're in the dark. All of us are in the dark. So that's probably, if there was one recommendation, I will definitely follow up. I wasn't aware, actually, that I don't know, maybe it's true or not true, but I would be very surprised if Ireland is not collecting disaggregated health data at the level of communities. Maybe they are, maybe they're not, but if they're not, they should be.
Thanks for that. And then one in from Kitty Holland of the Irish Times. So it sounds like you're talking about institutional racism, Dr. Ryan. How can travellers and their allies call this out?
There's many definitions. I don't want to get into the definitions of institutional racism versus racial bias. There's so many different levels. But there's no question that in Ireland there's been institutional issues over many years against many different groups. If you happen to be an unmarried mother in Ireland, or you happen to be in other groups, or you happen to be the child of a poor family sent to Borstal, there have been many cases where institutional bias and institutional damage has been done by the way we deal with any community that we have. There's no, I believe that most people in Ireland, even amongst the authorities, aren't institutional racists in themselves, but the institutions and their behave in a racist way, because it's not associated with tolerance, it's not associated with inclusion, and there are deep biases in the way those systems work. There are deep presumptions around what people are, who they are, what they are, and how they operate. So in that sense, there is institutional racism, but it's, you know,
so welcome.
It needs to be addressed by not calling everyone a racist. You know, the issue is systems themselves behave in racist ways. They're driven by racial bias. They're driven by ethnic bias. They're driven by class bias. They're driven by what people have learned their whole lives and the presumptions they make about other communities. And that then becomes very insidious, because it's very hard to change, because no one sees themselves then as a racist. No one sees themselves as having a problem. The problem is with all the other people. And until we all recognize that we collectively have a problem, we all have a problem. And if you call that institution racism, you can label it that way. But the reality is we have a problem as a society. There are people who are marginalized, excluded, and are suffering mentally for that. They're suffering physically for that. You can argue the cause, you can argue the fault, you can argue all of that, but it has to be recognized there are people who have lived outside our system, on the margins of our system, for decades and for generations. And we continue to do that. If you call that institutional racism, then that's what it is. But it will only change if everybody recognizes that and recognizes they have a responsibility and a part in the solution. And it's not someone else's job, and it's not just the government's job, and it's not that person's job, and it's not the the education system's job. It's everybody's job. And I think the othering of people and then the othering of the solutions is what's causing the problem. It's somebody else's issue all the time. It's not mine. And I do think we have to change. We need to all accept our part in the blame for a problem that's affecting our society. It's affecting who gets houses, it's affecting who gets healthcare, it's affecting educational attainment, it's affecting mental health. It's having that effect. That can't be argued. If that's happening because institutions are behaving systematically to make that worse, then that's a real problem. But that's not the only problem. Everybody's the problem. And therefore, everybody must be the solution. Because we end up in these simplistic arguments around whose fault is it? It's everybody's fault. All of us. And we get to fix it because we get to elect the politicians. We are the institutions. The citizens are the institutions. And if the citizens decide to change the way we deal with this issue, then it shall be changed.
Great. I think that's a very powerful place to leave the conversation, because I'm aware we have you over time as well. But just thanks for your input, Dr. Ryan. I think we all have a bit of learning to come from that. And I'm going to hand you back over now to my colleague, Liana.